had with the Africa Cancer Foundation, which the First Lady of Kisumu chairs. The health workers, including those in the Eldoret region, will also be engaged as cervical cancer campaign ambassadors. They are excellencies, the ambassadors. We will be expecting them to converse with their patients, friends, and family about cervical cancer and cancer in general. I'm happy to learn that during this campaign period, an international organization, Mark, Sharp, and Dome, MSD, through UNICEF, and the National Vaccines and Immunization Program, is coordinating the distribution of 800 and counting, and I have been at the forefront in the fight and campaign against cancer. We have been working closely with the Africa Cancer Foundation to spearhead this campaign, and the efforts are bearing fruit. Cancer Foundation was founded in 2011, the month of July, after I myself had had a rather unfortunate experience with prostate cancer itself. And my story can be told another day. As a government, we are constructing an ultramodern cancer treatment center at the Jaramogi Oginga Odinga Teaching and Referral Hospital, which once complete will be a big relief to cancer patients. At the moment, those seeking cancer treatment have to travel to Kenyatta National Hospital, Moi Hospital in Eldoret, and the new hospital at Kenyatta University Teaching, Referral and Research Hospital, which is now perhaps the most advanced center for cancer treatment and research in our republic. Many others also spend a lot of money seeking treatment overseas. But now we are happy that with the facility at Kenyatta University Hospital, the Kenyatta University Teaching, Referral, and Research Hospital, with a very, very modern cancer center with proper imaging, will stop some of our people on going on that expensive trip abroad, either to be diagnosed or to be treated with cancer. I'm happy to report that the construction of this cancer treatment here, just across where we are now, is going to join the league of the Kenyatta University Teaching, Referral, and Research Hospital that is already a going concern in our country. Mama Kisumu has also been very instrumental in spearheading the campaign against cervical cancer. She has worked with partners in the creation of the Kisumu Cervical Cancer Alliance's new website, www.kisumucanceralliance.org. Shall I repeat? www.kisumucanceralliance.org. This website is important to cancer survivors and the general public as a whole, as it provides more information to women diagnosed with cervical cancer. Mama Kisumu, through the Africa Cancer Foundation, has continued to provide vegetable corn gardens, one of which is standing behind you there, to cancer patients undergoing either behind or in front of you, depending on how you are standing, but these guys is behind them, so they can turn around later and picture it, but you are seeing them, so you can understand what behind means in this context. Okay, so those undergoing treatment at Jaramogi Oginga Odinga Teaching and Referral Hospital can take advantage of this through our Empower project. The 6-tier garden has a variety of vegetables, namely kale, spinach, African nightshade called managu, spring onions, coriander or dania, and beetroot. So far, 38 patients have benefited from this initiative. Ladies and gentlemen, we must all join hands in fighting all forms of cancer. The national government, in its 2019-2030 cancer policy, has highlighted interventions and framework to help tame cancer. These interventions include systematic implementation of evidence-based interventions of prevention, screening, timely diagnosis, treatment, survivorship, and palliative care, financing, monitoring, and research. The Council of Governors, through the Health Committee, which I chair, has taken a deliberate and strong position on the fight against cancer and is supporting various policies and partnerships involved in this campaign. Let us all not give up the battle against cancer, because cancer can be defeated. The simplest way to win the war is through early diagnosis. And the more we are aware of that, and the more doctors themselves are aware of that, nurses and community health workers, making people aware that frequent health checks from the dispensary, health center, sub-county hospital to the referral hospital is very important and very necessary. I'm quite sure that Dr. Ganda and his team have already equipped the community health workers with knowledge on how to teach and advise our people in the villages about cancer and about regular health check programs in our facilities from the grassroots upwards. I thank you, ladies and gentlemen, very much for coming here today, joining us today, and I hope you will take the message forward to your colleagues in the villages. Asanteni sana, and Mungu awabariki. Makofi bwana. Asante.
A better one. That we come to the end of this function, and after this, yes, national anthem. Thank you. Now we are free, and the governor's team will be led for some photo session. Oh, Paul, press conference first. First ladies can join the governor. Mbok nango.
What's up? If you can tell us about the Lounch and the time.